All right, so our next section is going to be over COPD, and that stands for chronic obstructive pulmonary disease. So what's going on with this disorder is that this is a group of different disorders that are kind of categorized together. So we have two that we're going to look at, which is emphysema and chronic bronchitis. There are a couple others that are categorized under COPD as well. But with all of these, we have progressive change with the lung tissue itself, and we also have obstruction that's happening within the airways. Okay, COPD is irreversible, and it progresses as the person ages. There is really no treatment for this. There's no reversing any of this stuff. So this is permanent changes that are going to be happening unless we get something like a transplant. Okay. Respiratory failure usually happens because we have such low oxygen levels and so high of our CO2 levels. Okay. We can wind up getting the right-sided heart failure, which is the cor pulmonale. Okay, this is the third leading cause of death in the United States. First being the heart disease that we've already talked about, and then second, cancer, and then third is going to be COPD. So basically our top three leading causes of death are, for the most part, preventable, which is kind of sad. Okay, so 11 million plus people have COPD. We think that there's probably more that are just undiagnosed. Okay, the number one cause is going to be smoking, but also secondhand smoking is also going to cause this as well. So if you have parents that smoked or anybody that you've been around for a really long time, COPD can also develop in somebody who is a non-smoker. Okay, inhalation of irritants, air pollution, frequent respiratory infections can also be causes as well. Okay, so we'll talk about why we have this pink dude up here in a second. Okay, so for emphysema, what's going on here is that we have changes within the alveolar tissue. That's really important to note that this is alveolar tissue versus any other type of tissue that's going to be affected in this. Okay, so we have the walls in the septum that is destroyed because of emphysema, and we are left with permanently overinflated alveolar structures. Okay. We also break down the elasticity of our lung, which is going to cause it not to contract back down to a smaller size when we expire our air. Okay. So here's an example of the alveolar tissue. So the first one is normal. Okay, we're supposed to have these divisions and septums in between. Okay, they're supposed to be tiny little air sacs within one cluster. And with emphysema, we have a destruction of all of that. And so then we wind up with these little blobby things, which we will find out later are called blebs. Changes within the tissue is going to affect how our lung actually functions. So let's look at the different things that are kind of going on with this. So the first thing is that we have a breakdown in those alveolar walls that's going to damage lots of things. So that is going to lessen the amount of surface area that we have to work with. So that is going to interfere with gas exchange. We also have a loss of pulmonary capillaries, which are also going to change how well we can do the gas exchange because now we don't have blood flow to that area. And then we have a loss of elastic fibers, which is going to affect how our lung is able to contract back to a normal size when we breathe out. Okay. We can also have collapse of the walls because of our bronchi that's also kind of being disrupted during this whole situation as well. We have fibrosis of it, which is going to make it very thick and hard and not as pliable as it used to be. It's also going to thicken it, which is going to narrow our airways, and it's going to lead to weakened walls, which is going to cause these collapsing to happen. Okay. And when it collapses, we're not going to be able to breathe out all the air that we've breathed in. So we have that oxygen that's going to go into our blood vessels, but then we have the CO2 that's coming back out, and we've got to get that back out as well. And if not, then we are trapping it within our lungs. And so it's going to be impeding with us being able to get that back out. Okay, so another thing that we can have is progressive difficulty with the expiration, like we just said. So we have what's called air trapping, and that is going to lead to us overinflating our lungs, and it's going to lead to the barrel chest, which is why our pink little dinosaur over here has a barrel as a chest. If you Google barrel chest, not the bodybuilder barrel chesting people, but just you can search barrel chest COPD, and you will see individuals who have that overinflated chest cavity because they're not able to they can get air in, they just can't get the air back out. So they wind up with a very huge chest area. Their shoulders can be, we can have like shoulders that are more up than normal. They look like they just took in a deep breath, but that's just sort of how they normally look. Okay. Diaphragm is also going to flatten in order to allow our lungs to expand more. And again, that recoil is not going to happen, which means we're not really going to get any smaller. Okay. With advanced emphysema, we actually have a loss of tissue. Okay. So again, we have the little blebs that form, which is where our alveolar tissue is kind of breaking down. And so we have all these air spaces, we have damaged tissue walls, and that's going to make them weak. And eventually they're going to bust open or rupture. And what that's going to cause is a pneumothorax, and we will see that later as well. Okay. We have very, very high CO2 levels within the body for these individuals. And that is going to lead us to a hypoxic drive, which we will talk about on the next slide. So I'll describe that in just a second. Also with this, we can have high blood pressure within the circulatory system within the lungs, and that can lead to our right-sided heart failure as well. Okay. So the reason this dude is pink is because he also has this high CO2 levels. And when we looked at carbon monoxide poisoning and things like that, with CO2 and carbon monoxide, if they have a lot of that in their system, they tend to turn like a pinkish kind of color. With our carbon monoxide poisoning, they're turning more of a cherry red color, but they're still going to be on the pink side, versus when we look at our chronic bronchitis individuals who are going to be more on the blue side. So this is why he's pink versus any other color. Let's talk about hypoxic drive and why this high CO2 level is going to cause us some problems. Okay, so we talked about earlier how that the reason, like if we are not controlling our breath, or I gave the example of like the 3 and 4 year olds who tend to hold their breath during a temper tantrum and will just pass out. Okay, now you can let your child do that all they want, because they're not going to harm themselves by doing that. Their body will eventually tell them to breathe. At that point, they're going to pass out and they're going to start breathing again, and they're going to be fine. But what is driving their body to take a breath finally is going to be the increased CO2 levels that we have. While somebody's holding their breath, they're not getting oxygen in, but they're also building up all the CO2 that's occurring within their lungs as well. That is eventually going to change the chemistry of their blood, and that is going to make our brain say, okay, we're going to have to breathe. Okay, so a high CO2 is what drives us to breathe, not oxygen at all. Okay, but with these individuals with a lung disorder, they do have oxygen that's driving them to breathe, and we'll see why that's a problem. Okay, so we discussed before as well that when you take in a breath, let's say that 100% of our blood is filled with oxygen and it starts circulating through our body. We only use about 25% of that when it gets to our tissues and where it needs to go. And so 75% of that oxygen is coming back with our venous blood coming back to the heart. Okay, so we have all of this extra oxygen, okay, just in case we do need it. Okay, so it's going to take a while for our oxygen levels to actually start falling when we're not breathing as well. Okay, so that means that our oxygen levels are going to have to be very low before our body's actually going to be able to react to this. Okay, we have a marked decrease in oxygen is necessary for our brain to pick up the fact that we are really low in our oxygen levels. Okay, but again, with our chronic lung disorder patients, that is what's driving them to breathe. Okay, because they have such a high CO2 level in their bodies all the time, their body has gotten used to it. It no longer reacts to that as far as getting them to breathe. So again, those oxygen levels are going to do that for them. So, super important points. If you need to highlight this, star it, circle it, whatever, do that with this sentence right here. So individuals are dependent on low oxygen levels to stimulate them to breathe. Okay. So if you are caring for a patient that has emphysema or chronic bronchitis, any other type of COPD, you want to keep them at a lower oxygen level. Okay. Normally, we want you to be anywhere between 98 and 100% oxygen. Okay. We do not want these individuals at that point, because that is actually going to keep them, or it's not going to, the low oxygen again is what drives them to breathe. So if we have 100% oxygen, their body is not going to be stimulated to breathe. Okay, so that's extremely dangerous for these types of patients. So when we give them oxygen, we only want to give them a little bit. So say they came into the hospital with kind of an exacerbation of emphysema. So it got really bad for some reason. And say they're sitting at 78% oxygen. Okay, we can oxygenate them back to somewhat normal, but we probably want to keep them anywhere between the 92 and 95 percentile range. We don't want to oxygenate them any more than that, because again, that's going to get them to where they're not going to breathe. So that as soon as they fall asleep, they're not going to be, nothing is going to tell them to breathe until their oxygen levels get really low. So this can actually kill them if we have too high of oxygen levels that we're giving them. Okay, so we have to be very, very careful about that with our emphysema patients and other COPD patients. Okay, so again, emphysema is coming from smoking cigarettes, also the air pollution that we talked about before as well. Okay, so in the beginning, they have dyspnea or difficulty time breathing when they're up doing things around the house. They're up running around, walking long distances, things like that. But as their emphysema gets worse, they have a hard time breathing while they are also at rest as well, which means that, they can just be sitting watching TV and still feel like they're having a hard time breathing when they haven't gotten up in a really, really long time. Okay. So again, they're going to be hyperventilated, which is going to lead them to having that barrel chest that we talked about before. And then they can go into what's called a tripoding position, which the little pink dinosaur dude over here is also exhibiting a tripod position. I also have a picture that I'm about to show as well of an individual who is tripoding. So they lean forward, putting all of their weight either on a table or on their knees. And what that's going to do is help their chest open up as big as possible so they can get that air in very easily without it causing any difficulty for them. Okay, so these individuals are not going to want to eat, and they're going to be very, very tired, which is going to lead them to a lot of weight loss. When you eat, your stomach is going to push up on your diaphragm, and that's going to make you feel like you can't breathe. Sometimes you feel like that at Thanksgiving meals. Okay, but this is for them all the time. Okay, So that is going to make them not want to eat. But then also sometimes, like we said before, that they had dyspnea on rest, eating is going to be a chore for them. Sometimes when you have that nasal congestion and you can't breathe through your nose and you have to breathe through your mouth while you're trying to eat, and it becomes very exhausting because you have to chew as fast as you can so that you can swallow it so you can breathe through your mouth. They feel like this all the time. Okay, so they just get to the point where they just don't want to eat anymore, and they're going to have all this weight loss that's going to happen. So we got a pretty skinny individual over here. Okay, it's going to lead to those clubbed fingers, which is the enlargement of the ends of their fingers right around where their fingernail is. I've shown you that previously, but if you need a refresher, just Google clubbed fingers and you'll see them. Okay, so here's an example of an individual tripoding. So a couple of things to note about this individual is he's pretty skinny. Okay, he's not a big man, pretty skinny. You can kind of see the barrel chesting of him in his chest area here. We also have where his collarbone is also sticking out and it like retracts way down in there. His shoulders are very up. So he's trying to allow as much space as he possibly can for those lungs that are overinflated within his chest cavity. Okay. We also see how skinny he is, and we also see him leaning forward to breathe as easy as for him as possible. And so that's the tripoding position. I cannot tell from here if he's got clubbed fingers or not. It's too far away, but you get the gist. So diagnostic tests, we can do chest x-rays to see kind of what's going on within their chest cavity. And we can obviously do pulmonary function tests to see what kind of oxygen levels they are normally functioning at, how much CO2 they have within their body, and things like that, how well they're able to breathe in and to breathe all of that air right back out, because they're going to have a lot of difficulty with that. Okay. So treatment, we wanted to avoid any sort of irritants. So if irritants for them was smoking, then we want to get them to stop smoking. That's a big deal for smokers, especially if they've been doing it for a long time. We want to get them immunized against the flu and pneumonia to help with any other infections that can add to this, because that's going to cause lots of problems for them that it wouldn't cause for the normal individual with the flu or pneumonia. Okay. We can put them through pulmonary rehab, which is sort of like, it's kind of like a mini little workout. We can teach them lots of different things like breathing techniques, but basically we're kind of working them out to try to increase the amount of air that they can take in or breathe out. So we're teaching them different breathing techniques. You were kind of working them out slightly so that they can just kind of increase the capacities as best as they can. Okay, so different breathing techniques that we can show them is something called pursed lipped breathing. Okay, so you can take a normal breath in, and then you are going to blow out the air through lips that are kind of pushed out, and that is going to slow down and control how well you are expiring your air. Okay, so you can also search a video on YouTube about pursed lip breathing to kind of see that in action. But with our pink little dinosaur over here, he's got his little pursed lips. Okay, we want to make sure that they have adequate nutrition and hydration. Again, they're going to be losing a lot of weight. So for these individuals, we want to pack as much calories and fat into a meal as we possibly can with the littlest amount of food. Okay, so we're going to talk about very nutrient-dense foods that we can give them to help with that, so that they don't have to eat as much. They won't feel as full. It won't affect their breathing, but they still get the calories that they need. Okay. We're also going to be wanting to put bronchodilators on board, because that's going to open up their airways so that they can breathe adequately enough. If we have sort of any infections going on them, we want to give them antibiotics. And then also that oxygen therapy, but again, being very, very careful with that oxygen therapy to not give them too much oxygen to where it could harm them. Okay. And then we can talk about lung reduction surgery. So this is an example here. If the top of their lungs is the most diseased part, if we have a lot of those blebs, we are worried that they may rupture, causing that pneumothorax. So we want to actually just go ahead and get those parts of the lungs out. And the tricky part with this is that they have to be well enough to be able to make it through the surgery, because with any type of lung patient, we really have to watch them to see how well that they could possibly handle this type of surgery, because sometimes we can put them to sleep, do the surgery, but they have a hard, very, very difficult time trying to wake them back up. Okay, so they have to be well enough to survive the surgery, but then bad enough that they actually need the surgery. So it's kind of being stuck between a rock and a hard place. Oops, sorry. Let me back up one. Okay, so factors that interfere with oxygenation of the blood in our patients with emphysema. Okay, so going back, you have to figure out what emphysema is, what is going on with them, and how that is going to affect how well they can oxygenate things. Okay, so with emphysema, our problem is with the alveolar tissue. We have destruction of it, which is going to lessen the surface area in which we can have the gas exchange going on. And that is going to interfere with how well we can have that gas exchange. The pulmonary capillaries were also disturbed, and so that's also going to interfere with the oxygenation of things. You can have collapse of the lung. You can have the bronchial tubes that become obstructed. That's not going to let the air in. You have all kinds of problems that are going to interfere with the oxygenation. Okay. So let's move on to chronic bronchitis. So now we have a completely different dinosaur over here. He is blue. He is bigger. He looks tired. He's still got his little cigarette inside of his hand, and he's got a little tank of O2 over here. So we're going to see what's going on with him. Okay, so with chronic bronchitis, again, a branch of COPD. Instead of causing problems with their alveolar tissue that we had with the emphysema, we have problems with our bronchi. Okay, so this usually comes from irritation from smoking and or pollution effects. Again, it's irreversible and progressive. What is happening here is that we have an inflammatory response that's happening to the irritants that we're exposed to day in and day out. So say we have a smoker. They're not smoking once every week. They're smoking every day, a couple of times a day. So their lung tissue is being irritated over and over and over again. And sometimes our inflammatory response is going to kick in and respond to this. So what's going to happen with these individuals is that their mucus glands that are going to kick in with inflammation are going to hypertrophy or get bigger in size, and then hyperplasia, meaning that we have more, the number of the mucus glands are going to increase as well. Okay, so we have all these different things happening. So the mucus production is going to be extensive with these individuals. Okay, with this irritation, we're almost going to develop like a scar tissue. So it's going to be very fibrotic, which means it's going to be very hard, and then it's going to be very thick. And with that, plus all the mucus that we're developing, we're definitely going to have some obstruction. Okay, oxygen levels are still low with this individual, and they're going to have a difficulty time breathing. Okay, so that can interfere with how much nutrition that they're taking in, because again, they're going to be tired. They're not going to want to eat. They're not going to have the energy to do so, and or they feel like they can't breathe, and they don't like that feeling, so they're just going to refuse to eat. Communication can also be altered as well, because if they have to be taking a breath every couple seconds, it's going to be very hard for them to carry on a conversation without getting tired. Okay. And then ADLs stand for activity of daily living. Okay, so those are going to also be affected. So things like being able to take care of the things around their house, being able to play with their dog, or to get up and to cook for themselves, or get up and do laundry, or clean the house or anything like that. They're going to be so fatigued that they can't do any of those things for themselves anymore. Okay. We can also develop the hypertension within the pulmonary circulation and that right-sided heart failure again. So there are similarities between this and emphysema, but again, we have some differences as well. Okay, so again, all goes back to cigarette smoking for the most part, and then pollution type problems as well, and then any type of other heavy exposure to any type of irritant, such as chemicals from like a place of work or just exposure for some other reason. Okay, so with these individuals, again, we have lots and lots of mucus. So I hope that you can guess that one of the signs and symptoms is that they're going to have a very productive cough. Okay, because they have all this mucus that they're producing, they got to get it out. So they're definitely going to have that. Their breathing rate is going to be increased. They're going to have shortness of breath. They will definitely have bronchi. They are not going to have just rales with the crackles. Okay, they're going to have bronchi. It's more severe because of the thicker mucus that has been produced in their lungs. So it's a harsher sound when you listen to them with a stethoscope. Okay, it is more severe in the morning. We kind of talked about that a little bit in class as well. And it's more severe in the morning because they've been laying down, all that mucus kind of accumulates. And so when they first wake up, they have to move all that mess out of there. So they're going to be coughing quite a bit in the morning. Okay. Again, we can have that airway obstruction from all the mucus. So that's going to lead to our low oxygen levels and our high CO2 levels. And that's going to lead to our cyanosis, which is going to give us a blue appearance, which is why he's a blue dinosaur versus anything else. Okay, but again, we have these high CO2 levels and low oxygen levels, which means they're going to be in a hypoxic drive for air as well. Okay, and we can have severe weight loss with this because, again, too short of breath to eat, they lose weight. So treatment options for these individuals is that we want to do everything to reduce their exposure to the irritants. So again, getting them to stop smoking if that's what they're doing. And then we want to treat infections as quickly as possible. All that mucus that's building up within their lungs is a perfect breeding ground for any type of bacteria and virus. So again, they're going to be struggling with lots and lots of infections. Okay. Again, vaccinating against flu and pneumonia, using antimicrobials when appropriate for any type of infection that they may develop. Expectorants to help thin and loosen that mucus within their lungs so that it's easier for them to cough up. Bronchodilators to open the airways up so they can breathe. They're going to get chest physiotherapy, kind of like our cystic fibrosis patients, because again, they're struggling with the same thing, too much mucus, blocking things, occurring for two different reasons, but basically we have a trouble with too much mucus. Okay, so with this, we're going to do the postural drainage where we have the head lower than the legs, and that is going to help drain it, and then we're going to do the percussion on the back to kind of beat it out of them so that they can move that mucus a lot easier. Okay, again, we want to do low flow oxygen with them because again, their CO2 levels are very high, so they're going to be in the hypoxic drive. And then nutrient substance that is going to help keeping them from losing too much weight. Okay, so things like Mucinex for the expectorants and any sort of albuterol type medication for the bronchodilator. Okay, so now we're going to get into vascular lung disorders in our next video.